I don't see any changes after PRP facelift. Is this normal? Had a PRP facelift with a few injections around my eyes and microneedling and plasma on my face. I do not see any changes whatsoever. Is this normal? The dermatologist assistant all told me I would see results right away, maybe even the next day.
Thank you for your question. You submitted a photo and you state in your question that you underwent a PRP facelift, which, as you described, involved a few injections, some microneedling, and the application of PRP over your face. And that the dermatologist's assistant said that you would be able to see results as early as the next day. And you're wondering why you don't see any difference. Well, certainly I can give you some guidance about my experience with PRP and give you some sense of what you may be experiencing. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon practicing in Manhattan and Long Island for over 20 years. We use PRP in our practice every single day, and we use it all day long. We've developed even a method of using PRP in combination with acellular matrix for hair loss. But in addition, I use PRP for wound healing, for acne scars, for fine lines and wrinkles, discolorations, and a variety of other indications, including scars. So I will just kind of go over with you some of the things of what PRP can and cannot do, and a little bit of the clarification, hopefully, in the terminology. So, first of all, it has definitely been a real challenge in dealing with the very flexible use of the word facelift. It begins almost years ago with the concept of vampire facelift. Vampire facelift became such a popular term that it actually outranked Botox in terms of search. And of course, for a surgeon, the term facelift really means one specific thing. It means the lifting of the skin, soft tissue, in a way that's vertical, and it's a surgical procedure. With vampire facelift, which does involve PRP, it's a combination of using PRP in a very specific way with the use of one syringe of a hyaluronic acid filler, such as Restylane, in small amounts in specific areas. Typically, the vampire facelift is used for people who are, let's say, women in their 40s who have reasonable structure but some volume loss and want to see an improvement in skin quality and glow, and it's a very conservative amount of volume correction with the use of a hyaluronic acid filler. So when you describe the term a PRP facelift, I think you can be certain that it wasn't going to actually lift your face. I think what the doctor intended to do was similar to like the vampire facelift, is to get your skin to look like it has more quality and volume, and to, like with the vampire facelift, lift the face away from the underlying skin to make the skin look brighter. Now, I think that the dermatologist assistants may have described your perception of improvement being the next day, maybe because they may have anticipated a little bit of a flush or a little bit of glow. Distinguishing what PRP does when it's injected under the skin as well as what it's done after microneedling is very important. When injected under the skin is stimulated through the improvement in the circulation as well as the quality of the fat cells underneath the skin, improvement of volume in the collagen, improvement of blood supply. Now, in my experience, it takes about 2 weeks and a little bit beyond to kind of see that result. We have had patients say that it takes about a week, but I would say it's rare for someone to have that significant of a sense of improvement by the next day. Now, I can tell you, because almost everyone in our staff over a certain age gets this procedure, this injection of PRP, we see each other the next day, and I could say that there's some situations where the person just looks healthier. So that being said, so that's what happens when you inject PRP. When you do PRP with microneedling, you have to allow the skin to heal. So usually what we do when we use that indication, we're doing it for fine lines, for discolorations, and we have to allow a few days for the microneedling to heal, which means that the needling depth has to be certainly significant to make a difference. So usually it takes about a week. It is very important that you weren't expecting the results of a facelift, because if you were, you are not going to be happy with the final result. I look at PRP and microneedling as limited to the top layers of skin, or at least up to a certain amount to the deeper levels of the skin. But if you want to get volume correction, you still need a filler. If you want sagging and lifting, you need surgery. So I think that you've had maybe some miscommunication with your doctor. I am certain that your doctor would have expected for you to follow up in a couple of weeks to see how things look and to get your feedback. If that's not the case, make sure that you reach out to your doctor and schedule that follow-up appointment and review your before photos and have another discussion about what you anticipated would result from this procedure. But again, it definitely, the term facelift just confuses things a lot in spite of this continuous evolution of the terminology. So hopefully, understanding some of these basic concepts, you'll be able to observe what the changes over the next few weeks and discuss the details of your perception with your doctor. So I hope that was helpful. I wish you the best of luck. Thank you for your question.